Hi, my name is Pelea Calderon, and I'm going to be talking about Sofosbuvir and Ribavirin in HCV genotypes 2 and 3. Definition. There are 6 main genotypes of hepatitis C virus, or HCV. Genotypes 2 and 3 account for approximately 30% of chronic infections worldwide. Although these two genotypes have historically been grouped together in treatment guidelines and clinical trials, accumulating evidence suggests that there are important clinical differences between them.
Hepatitis C clearly we classify as genotype 1, genotype 2, genotype 3, genotype 4, 5, and 6 clearly. Usually, different genotype not really associated with the risk of disease progression, except some study, particularly from India, they found that genotype 3 may be associated with more fatty liver disease, and that might associated with the risk of fibrosis progression, or also fatty liver might associated with unfavorable therapy to pegylated interferon. So that's still not really strong, but we know that the genotype is associated with the treatment response. Particularly if you treat the patient with pegylated interferon plus ribavirin, we know that genotype 2 is easy to treat. I mentioned earlier, with 24-week peg interferon ribavirin, in genotype 2, the cure rate is over 90%. Genotype 3, it will be about 80 to 85%. Genotype 1, the cure rate with peg interferon ribavirin, treatment duration even longer to be 48 weeks, the cure rate will be around 50 to 55% in Caucasian and 70% in Asian. So mainly it associated with the treatment response with interferon-based therapy. But this will be less important when we talk about interferon-free treatment with the new DAA, and this one late association with the response. However, as I mentioned during my talk, that genotype 3 still become quite difficult to treat with DAA therapy.
Applications in medicine. In clinical trials, treatment with a combination of the nucleotide polymerase inhibitor Sofosbuvir and the antiviral drug Ribavirin was associated with high response rates among patients with hepatitis C virus genotype 2 infection, with lower response rates among patients with HCV genotype 3 infection.
Hi, I'm Dr. Anantraman, consultant endocrinologist at Magna Clinic for Obesity, Diabetes and Endocrinology, Bangalore, India. Hi, I'm going to talk about treatment of HCV 2 and 3 infected patients. HCV can occur due to 3 different genotypes, genotype 1, 2 and 3. Among these 3 genotypes, 2 and 3 are very common in India, especially genotype 3 is extremely common in South Asia and India. And these HCV genotypes are treated by combination antiviral therapy. For instance, genotype 2 is more drug responsive than genotype 3, and also it depends on whether cirrhosis has already occurred in the liver because of hepatitis C infection. In case the cirrhosis has already occurred, then the duration of treatment has to be longer and will be of the duration of 24 weeks. So without cirrhosis, in both the conditions, the treatment ranges between 12 and 24 weeks. So the current treatment is with a combination of Sofosbuvir and Ribavirin. These are the 2 agents which are used to treat HCV2. And in HCV3, you have a combination of Sofosbuvir and another agent, which can be either interferon or some other drug. So these are the current treatments, but treatment of HCV itself is a rapidly changing field, and guidelines for these are updated regularly, and you should look up the latest treatment before starting on treatment.
Pros and cons. Pros. Patients receiving Sofosbuvir Ribavirin had substantial reductions in circulating HCV RNA levels during the first week of treatment. Cons. Some patients discontinued therapy because of elevated alanine aminotransferase, and aspartate aminotransferase levels. Others because of malaise and headache, and one patient with HCV genotype 3 receiving 24 weeks of treatment discontinued after attempting suicide. Diarrhea and irritability were observed more frequently in the 24-week group than in the 12-week group.
For genotype 2, which is somewhere around 15–20% in the US, the only approved regimen is Sofosbuvir and Ribavirin. This is generally used for 12 weeks, though some people extend the duration to 16 weeks in patients with cirrhosis, particularly those that have failed prior therapy. This offers a SVR or cure rate of about 90+% and is the only FDA approved option that is all oral at the current time. Other of the approved agents have in vitro activity in genotype 2, but have not been extensively evaluated and are not approved by the FDA at the current time. At the current time, we don't have any FDA-approved options for people who fail our current first-line all-oral agents. Some people have tried retreating patients with either one of the other regimens or the same regimen for longer. However, right now that is not FDA-approved, and we really don't know the optimal duration. I think a lot of these patients will end up in the next generation of treatments. So we have from all of these companies newer drug regimens that are coming out with more potent drugs in the same class that are both more pan-genotypic, but also which seem to have activity against some of the variants that are resistant to the first generation of drugs. Though I think at the current time, our options are limited, particularly for patients with milder liver disease. They certainly should wait for newer data and better regimens. For those with more advanced liver disease, we have to decide on a case-by-case basis whether to try something outside the box today, enroll them in a clinical trial, which would be the best option so we can learn, or wait for what's coming out tomorrow. For patients with cirrhosis who fail prior therapy, this is the group of patients in whom we need research the most. Whether it's going to be adding additional agents, extending the duration of therapy, or a combination of those two factors, I think remains to be determined. But
Issue applied in Ecuador. Hepatitis is not an endemic disease in Ecuador. It is present in less than 8% of the population. This kind of treatment is not being used or studied in the country. Conclusion. Therapy with Sofosbuvir Ribavirin for 12 weeks in patients with HCV genotype 2 infection and for 24 weeks in patients with HCV genotype 3 infection resulted in high rates of sustained virologic response. Thank you.